Today, we will be understanding hair loss and possible effective treatments that can be done to reverse baldness. Hair loss is a common concern affecting millions of individuals worldwide, regardless of age or gender. It can significantly impact one's self-esteem and quality of life. Fortunately, advancements in medical science have provided a range of treatments to combat hair loss and promote hair regrowth. In this video, we will explore the causes of hair loss and discuss some of the best treatments available today. Before delving into treatments, it is essential to understand the underlying causes of hair loss. Some common factors include, number 1, androgenetic alopecia. Androgenetic alopecia, or also known as male or female pattern baldness, is the most common cause of hair loss. It occurs due to a genetic predisposition and hormonal imbalances, leading to the gradual shrinking of hair follicles. Number 2, Telegen effluvium. Telegen effluvium is a type of hair loss that is often triggered by significant physical or emotional stress, hormonal changes, nutritional deficiencies, or certain medications. It causes the hair follicles to enter a resting phase, resulting in excessive shedding. Number 3, alopecia areata. Alopecia areata is an autoimmune disorder where the immune system mistakenly attacks the hair follicles, leading to patchy hair loss on the scalp or body. Number 4, underlying medical conditions. Hair loss can be a symptom of underlying medical conditions such as thyroid disorders, scalp infections, or certain skin diseases. So the question is, what are the best treatments for hair loss that are available today? Number 1 is medication. One popular medication to prevent or reverse hair loss is minoxidil or Rogaine. Minoxidil is a medication that is available over the counter. Minoxidil is a topical medication that promotes hair growth by revitalizing the hair follicles and is proven effective for both men and women with androgenetic alopecia. Another popular medication for hair loss is finasteride or Propecia. Although this is a prescription-only medication, finasteride is an oral medication primarily for men. It inhibits the production of the hormone dihydrotestosterone or DHT, which is responsible for the shrinking of hair follicles. Number 2 option for hair loss treatment is platelet-rich plasma therapy, or commonly known as PRP. PRP therapy involves injecting concentrated platelets derived from the patient's own blood into the scalp. Platelets contain growth factors that stimulate hair growth and promote healing in the hair follicles. This treatment is suitable for androgenetic alopecia and alopecia areata. Number 3 option for hair loss treatment is hair transplantation. Hair transplantation involves the surgical relocation of hair follicles from a donor area, which is typically at the back of the scalp, to the thinning or balding areas. It offers a permanent solution for hair loss and can provide natural-looking results. Follicular unit transplantation, or FUT, and follicular unit extraction, or FUE, are the two main techniques used. Number 4 option for hair loss treatment is low-level laser therapy, or LLLT. LLLT utilizes red light wavelengths to stimulate hair growth at the cellular level. It increases blood flow to the scalp and encourages the regeneration of hair follicles. LLLT devices are available as combs, helmets, or caps and can be used at home. Number 5 option for hair loss treatment is lifestyle modifications. It is true that certain lifestyle changes can positively impact hair health and reduce hair loss. And you can start a lifestyle change by eating a balanced diet, rich in vitamins, minerals, and proteins. Avoiding excessive heat styling, chemical treatments, and tight hairstyles can also help reduce the effects of hair loss, as these procedures can cause hair damage and breakage. Managing stress levels can also greatly reduce hair loss, and it can be done through practices such as exercise, meditation, or therapy. And last but not the least, avoiding tobacco and excessive alcohol consumption. Tobacco and alcohol contains chemicals, which can hinder hair growth. That is why it is best to avoid them to reduce hair loss. In conclusion, dealing with hair loss can be a distressing experience, but with the range of effective treatments available, regaining a full head of hair is possible. It is also important to consult a healthcare professional or a dermatologist to determine the underlying cause of your hair loss and devise an appropriate treatment plan. Remember, the best results are often achieved through a combination of treatments tailored to your condition. For more contents about health and wellness, subscribe to our YouTube channel, Better Health and Wellness, by clicking the subscribe button and hitting the notification bell. And always, don't forget to like and share.